small study, 200 women, found that 55% of women who had been diagnosed with unexplained infertility had ureaplasma in their uterus. At a 6-month follow-up after treatment, so they gave antibiotics only, they didn't do anything else, they found 42% of these women were pregnant. So over 100 of those women had chronic endometritis, had a uterine microbiome disruption. And then after they treated them, nearly half of them went on to get pregnant within those 6 months without intervention. I think that's really cool. Another small study, 100 women, they split them into 2 groups. One group had unexplained, the other had infertility, but had a diagnosis for that infertility. And they found that 32% of the women who had unexplained infertility had ureaplasma in their uterus. Only 8% of the women who had a fertility diagnosis did. So that's not to say if you have PCOS, if you have hypothyroidism, if you have a reason as to like a code as to why they think you're not getting pregnant, that doesn't negate the fact that you could also have a microbiome issue. But I think this is a really interesting, like 1/3 of the unexplained actually had some sort of dysbiosis, and less had obviously in when they had a diagnosis, but not zero, right? The good news is it's fixable. And I've seen this time and time again over the last couple of years that we've really started investing in this type of testing, is women from all walks of their journey treating and getting pregnant, whether they're getting pregnant unmedicated or whether they're stepping back into IVF and being successful there. It's something that is fixable.